Welcome, everyone, to Wellness Waves, the show dedicated to empowering you with life-saving health information. Today, we're tackling a topic that can strike fear into anyone's heart: what to do if you're having a stroke and you're completely alone. It's a terrifying thought, but as we'll discuss today, knowing a few critical steps can be the difference between life and death, or between a full recovery and long-term disability.
That's right. Strokes don't wait for convenient times or places. They can happen anywhere, at home, in your car, at work, and unfortunately, many people, especially older adults, live alone. The traditional advice often assumes someone else is there to help, but what if they aren't? Our goal today is to arm you with the knowledge to respond effectively in those precious solitary moments. We're breaking down 5 life-saving actions that everyone needs to know.
Before we jump in, a quick disclaimer. This information is for educational purposes only and is not a substitute for professional medical advice. If you suspect you or someone else is having a stroke, call emergency services immediately. Segment 1. Recognizing the symptoms immediately. The F.A.S.T. acronym and beyond. Okay, let's kick things off with the absolute first and most crucial step: recognizing that you are, in fact, having a stroke. This sounds straightforward, but as the video highlights, it's often much harder than it seems.
Exactly. Your brain is under attack, which can muddle your thinking. Denial is a huge factor. You might try to explain away the numbness or confusion as just being tired or a weird cramp. But with a stroke, every single minute counts. Brain cells start dying within minutes of blood flow being interrupted, so immediate recognition is paramount.
The medical community uses the F.A.S.T. acronym, which is excellent for remembering the primary signs. But when you're alone, you have to perform these checks on yourself. Let's break it down. F is for face drooping. The video suggests looking in a mirror or using your phone's camera. Try to smile. Does one side of your face droop? Is your smile uneven? This is a classic sign. Imagine you're brushing your teeth and suddenly your reflection looks off. Don't dismiss it. A is for arm weakness. Try to raise both arms in front of you. Close your eyes and try to hold them steady for about 5 seconds. Does one arm drift downward? This isn't just a tired arm, it's a lack of control, a neurological symptom. It might feel like one arm is suddenly much heavier than the other. S is for speech difficulty. Say a simple sentence out loud like, "The sky is blue today." Are your words slurred or garbled? Can you even form the sentence correctly? Sometimes it might feel like your tongue is thick or you just can't get the words out. Others might find their speech is totally incomprehensible. T is for time to call emergency services. If you notice any of these symptoms, even if they seem to resolve, time is absolutely critical. Do not wait to see if things improve. Strokes rarely get better without immediate treatment, and delaying action only increases brain damage.
And it's important to note that while F.A.S.T. covers the most common symptoms, there are other warning signs mentioned in the video that you should be aware of. Sudden numbness or weakness, especially on one side of your body. Sudden confusion or trouble understanding what's happening around you. Sudden vision problems in one or both eyes. Sudden dizziness, loss of balance or coordination problems. You might feel like the room is spinning or you suddenly can't walk a straight line. A sudden severe headache with no known cause, often described as the worst headache of your life.
The key here is sudden. If these symptoms appear abruptly, treat it as an emergency. Don't rationalize it away. Your life could depend on that split-second decision to acknowledge what's happening.
Absolutely. It takes courage to admit something serious is happening, especially when you're alone, but that courage is your first line of defense.
Segment 2. Call emergency services immediately. Your lifeline. Once you recognize those symptoms, the second step is to call for emergency medical help as quickly as possible. Again, this sounds obvious, but it gets complicated when your speech is affected or your coordination is off.
Right. The priority is 911 in the US or your local emergency number. Even if your speech is slurred or you can barely articulate, call. Dispatchers are trained to recognize stroke symptoms. If you can, just say stroke repeatedly. If you can't speak clearly at all, stay on the line. Many emergency systems can trace your location.
What if you can't reach your phone or can't dial? The video shares some excellent alternative communication methods. Voice commands. Most smartphones respond to "Hey Siri" or "OK Google." You can command them to call 911 or call emergency services. Make sure this feature is enabled on your phone before an emergency. Emergency buttons. Many smartphones have emergency features. Rapidly pressing the power button several times, usually 5 times, can automatically dial emergency services or bring up an SOS menu. Familiarize yourself with your phone's specific function. Medical alert devices. If you have a medical alert pendant or bracelet, activate it immediately. Smart speakers. If you have an Alexa, Google Home, or similar smart speaker, you might be able to use voice commands like "Alexa, call for help," or "Google, call 911." Some require a specific setup to enable emergency calls. Making noise. If you live in an apartment or connected housing, bang on walls or floors. This might alert a neighbor who can then call for help.
Once connected, try to communicate clearly. State that you think you're having a stroke. Give your precise location and mention if your door is locked. This is crucial so responders don't waste time breaking in. Describe your symptoms and, most importantly, when they started. The exact time your symptoms began is one of the most critical pieces of information doctors need, as certain effective stroke treatments are time-sensitive.
That brings us to hospital choice. If possible, request transportation to a designated stroke center. These facilities are specialized with specific protocols and equipment for treating strokes quickly. Some ambulance services can even bypass closer hospitals to get you to a stroke center if it's warranted. This decision can profoundly impact your outcome. Segment 3. Make yourself accessible to help, clearing the path. You've called for help, now what? The third step, and one often overlooked, is ensuring that help can actually reach you when they arrive. This might seem minor, but it can prevent critical delays.
Absolutely. First, unlock your door if you're able. This might sound simple, but responders can lose precious minutes if they have to force entry. If you live in a security building with multiple entry points, try to move towards the main entrance if you can safely do so.
If you're in a remote area or your home isn't easily visible from the street, find ways to make your location obvious. Turn on outside lights, open blinds or curtains, and position yourself near the front door or in a main room where first responders are likely to look.
Next, if possible, gather essential information for paramedics. The video suggests a list of your current medications, your medical history, especially conditions like high blood pressure, diabetes, or previous strokes, your contact information for your doctor and emergency contacts. Having this ready can save crucial time at the hospital.
And finally, create a safe environment while you wait. Clear a path to your location. Move any furniture or objects that might block medical equipment. If you were cooking when symptoms started, turn off stoves or other potentially dangerous appliances. If you have pets, secure them in another room if possible. This prevents them from interfering with emergency responders, who need to focus solely on you.
These preparations might seem secondary when you're experiencing stroke symptoms, but they can significantly reduce delays in receiving treatment. Every minute counts, and every obstacle removed speeds up that critical first response.
Segment 5. Position yourself safely while waiting, minimizing harm. So, help is on the way. The fourth critical step is how you position yourself while waiting for emergency services. This can directly affect your condition and prevent further injury.
The goal is to minimize complications. If you're experiencing weakness or dizziness, common stroke symptoms, it's best to lie down on your side rather than remaining standing or sitting. This reduces the risk of falling and sustaining additional injuries, which could complicate your treatment.
The recovery position is ideal. That's lying on your side with your top leg bent and your bottom arm supporting your head.
This position helps keep your airways clear, which is vital.
Try to keep your head slightly elevated if possible, perhaps with a small pillow or cushion. For some types of strokes, this position may help reduce pressure in the brain.
Very important, avoid eating or drinking anything while waiting. Strokes can affect your ability to swallow properly, creating a serious choking risk. Additionally, some stroke treatments can't be administered if you've recently eaten, which could delay vital interventions.
Also, remove any constricting clothing. Loosen tight collars, belts, or anything around your neck, chest, or waist that might affect your breathing or circulation. Comfort is important, but more so, unrestricted breathing.
Try to stay warm without overheating. Stroke can affect your body's temperature regulation, and extreme cold or heat can place additional stress on your system. A light blanket if you're cold, but nothing heavy.
And most importantly, though easier said than done, remain as calm as possible. Stress and panic can raise blood pressure, which could potentially worsen stroke damage. Focus on breathing slowly and steadily while you wait for help. Try to regulate your breathing, even if just for a few seconds at a time. It can make a difference.
We're going to take a quick break, but when we come back, we'll discuss the final crucial step, documenting your symptoms, and then we'll talk about what happens after the emergency and, importantly, how to prevent a stroke in the first place.
Segment 5. Document your symptoms and their progression, providing key information. Before the break, we covered how to recognize a stroke, call for help, make yourself accessible, and position yourself safely. Our fifth and final critical step while waiting for emergency services is to document your symptoms and their progression.
This might seem difficult when you're in distress, but it's incredibly valuable for medical providers. The exact time your symptoms began is one of the most critical pieces of information doctors need. As we mentioned, certain effective stroke treatments must be administered within specific time windows from symptom onset. If you can note that exact time, it could determine your treatment options.
If you're able, use your phone. It's not just for calling. Record the exact time symptoms began. Note which symptoms you experienced first. How have symptoms progressed or changed? Are they getting worse, staying the same, or improving? Any actions you've taken, such as medication or position changes. If writing or typing is difficult, consider using your phone's voice recording feature to verbally track this information. You can just speak what's happening.
Also, note if you've taken any medications recently, especially blood thinners, pain relievers, or blood pressure medications. This information significantly affects treatment decisions at the hospital.
A very clever tip from the video: if your condition allows and you have the presence of mind, set an alarm on your phone to go off every few minutes. This can help prevent losing consciousness without anyone noticing, and serves as a backup in case you become unable to call for help again.
The specific details you document during this emergency can profoundly influence your treatment plan once you reach medical care. This isn't just about giving doctors more information, it's about giving them the right information to save your brain function.
Segment 6. Beyond the emergency. Hospital care and prevention. Surviving a stroke alone doesn't end when emergency services arrive. What happens at the hospital and in the weeks and months following determines your long-term outcome.
Once at the hospital, stroke treatment focuses on restoring blood flow to your brain as quickly as possible. For ischemic strokes, caused by blood clots, treatments might include clot-dissolving drugs like TPA or mechanical clot removal. These interventions are most effective when administered within hours of symptom onset, which is why recognizing symptoms and getting help quickly is so crucial.
Recovery is a marathon, not a sprint. It continues long after the initial emergency. Physical therapy, speech therapy, and occupational therapy may be needed to regain functions affected by the stroke. The brain has remarkable plasticity, and with proper rehabilitation, many stroke survivors regain significant function.
And while knowing how to react during a stroke is vital, the best way to survive a stroke is, of course, to prevent having one in the first place. Managing risk factors is key. High blood pressure, regular monitoring and medication if needed. High cholesterol, diet, exercise, and sometimes medication. Diabetes, strict blood sugar control. Smoking, quit smoking immediately. Excessive alcohol consumption, moderate your intake.
Regular checkups with your doctor can help identify these risk factors before they lead to an emergency. And for those at high risk or who live alone, consider preventative measures like regular check-in systems with friends or family, medical alert devices, or even smart home technologies that can detect unusual patterns. A stroke risk assessment with your doctor is also a great idea.
Time truly is the most critical factor in stroke survival and recovery. Every preparatory step you take before an emergency, and each minute saved during one, translates directly to preserved brain function.
By knowing how to recognize and respond to a stroke when alone, you give yourself the best possible chance of not just surviving, but of recovering well. It's about empowering yourself with knowledge in the face of a terrifying possibility.
This has been an incredibly important discussion, and we hope it has equipped you with valuable, potentially life-saving information.
We want to hear from you. Were you already familiar with these steps? Do you have any other advice or experiences to share? Leave your comments below and help others be better prepared. Information truly saves lives.
If you found this video or podcast helpful, please give us a like, subscribe, and share it with someone you care about. You never know whose life you might impact.
And don't forget to subscribe my channel for next important wellness topics.
Thank you for joining us on Wellness Waves. Stay healthy, stay safe, and stay informed.